Hey friends, welcome back to the channel and another video. My name is Dr. Caroline, a practicing board-certified family medicine physician, and in today's video, I want to share some of the things I wish I knew sooner as a primary care doctor. The first one, which is a big one for me, is that work-life balance is not built in. There is this massive misconception that primary care is like an easier specialty and there's great work-life balance, etc. And in some cases that probably is the case, but not in all cases. And they try to sell you on this, like recruiters will use work-life balance as a way to sell you on a particular opportunity. And no shade to recruiters, they're great. And I'm not gonna lie, back when I was in medical school, I probably did think that work-life balance was built into primary care. But this is not at all the case. Every medical specialty has its own type of difficulty, and primary care is no exception. Now, of course, if you work in a practice where you're seeing like 10 patients a day, that's a pretty great gig. But the majority of primary care physicians are probably seeing 20 plus patients a day, completing admin tasks, completing requests from other patients that are not even on the schedule, taking call, etc. It's a tough job, rewarding, and it's a massive privilege, but tough nevertheless. You have to create this so-called work-life balance for yourself. No one is going to hand it to you just because you're a primary care physician. So that's something I would probably suggest to, let's say, a resident that's transitioning into the attending role, is to try to establish that work-life balance sooner, because it will definitely help in the long run. The second thing, which kind of goes along with the work-life balance topic, is don't just focus on self-care, but equally prioritize work care. What do I mean? So when you finally get a week off to go on holiday, take a rest or whatever, after having worked weeks or months on end and feeling completely drained, your focus is on self-care, as it should be. So you're probably thinking about sitting on a beach somewhere, going to a spa, etc. Again, as it should be. But the problem is, after that week of rest and self-care, you're right back into the stressful workflow that caused you to feel completely drained and on the brink of burnout. And you basically can't wait to be off again. Kind of sounds like a dead end. Prioritizing work care just as much as self-care was something I learned well into being an attending, after I'd experienced burnout myself. So this involved changing my workflow to fit my energy, finding ways to enjoy my work so that it doesn't feel draining, and more importantly, learning how to strategically maximize productivity without overworking. And it became like this challenge I looked forward to every workday, and that in turn boosts my energy even more, and it makes me feel good because I feel in control. One of my favorite YouTubers, Ali Abdal, said, "When you feel good, you generate energy, which boosts productivity. And this productivity leads to feelings of achievement, which in turn makes you feel good all over again." This quote is so true in every way based on my experience. And as you can imagine, this helps reduce stress, which means less risk for burnout. The last thing I wish I'd learned sooner is that you can actually make a high income as a primary care doctor. Primary care has been known to be a lower paying specialty. Again, probably because of the misconception that it's an easier specialty, amongst other reasons I presume. And some people might not choose to go into primary care because of it being a lower paying specialty. Now, physician compensation is affected by multiple different factors, so I certainly don't want to make any generalizations. But one of the biggest things I wish I knew sooner is that there are ways to maximize your pay. I used to think that as a primary care doctor, you're going to earn around $200,000, and that's just kind of where you live, nothing more. And so thinking about compensation was not a huge thing for me prior to becoming an attending, because I didn't think there was anything I could do to affect my salary. But that was far from the truth. And again, I don't want to make any generalizations, but one of the things I came to learn well into being an attending, and again after I'd experienced burnout, is that if you want to maximize your pay, learn how your compensation is generated in the first place and heavily tap into that. This is how I was able to eventually break through my income ceiling. And now I teach other primary care physicians how to do the same. Now, our program is specifically for RVU-based primary care physicians, or physicians that have the potential to maximize their income through productivity. And so if you have struggled to break through your income ceiling and you're feeling overworked, overwhelmed, and essentially underpaid, then I definitely invite you to apply to our program. The link will be below in the description box. Alright friends, I hope this video was interesting to you. If you liked this video and enjoy this type of content, then definitely consider subscribing, because I do post a video like this every single week, doing my best to help primary care physicians maximize productivity and scale their income without overworking or risk falling into burnout. Thank you so much for watching. Make sure to leave a like and share this video with your colleagues. I'll see you next time.